Welcome back, everyone. Next, we have Helo Corp. It's a data-driven wellness technology company leading the development of wearable and other biodata gathering devices and artificial intelligence to drive human wellness transformation. So over the last 8 years, Helo has created and sold 13 devices worldwide, generated over 125 million in revenues, and it has zero debt. Here to present to you today is Helo's chairman and CEO, Sean McVeigh. He graduated from Trinity College Dublin with an engineering degree and Master of Science. After 10 years with BP, he earned his MBA at the University College Dublin before establishing a medical device consulting company and launching successfully, exiting several technology companies. Mr. McVeigh joined Helo in 2013. We're so happy to have you on our conference today. Sean, welcome.
Thank you very much, Anna. Delighted to be here. And thank you, everybody, for taking the time to listen to what I hope will be an interesting insight into Helo Corp. So I'm going to take you through a few short slides, play a video for a 3-minute video, and then bring you back into some more slides after that, and then we can have some questions. So I will be making some forward-looking statements, so I'd like to bring your attention to this disclaimer, and also to let you know that you'll find our financials on the OTC website. So let's just get into it. Helo is a wellness technology company. We're all about creating innovative biodata gathering devices. We analyze the data gathered, and we provide our wearers and users with ongoing and continuous feedback to support their human transformational change. So, as Anna mentioned in the introduction, in the last 8 years, we created 13 devices, and we sold them worldwide, and we generated over $125 million in revenue. And unusually, we have zero debt. So just to give you some pictures here, the images on the top are a list of all of our devices. I joined Helo in 2013, but our tech launch really started 2016. And in 2017, we were invited by Toshiba to their stand to present our device at the CES in Vegas. In 2018, we then went back with our distributor World to present again some of our other devices. And that was a great platform because it springboarded us into 3 years of significant growth. And in those 3 years, we topped $83 million. But there was a lot of challenges because these are all one-time sales. And I'll come into this and discuss it a bit more later. 2022, we decided to take a step back, restructure for the big play, because for us, it's all about sustainable growth. And we have signed up some strategic partnerships with Impersona, VGen, and Vitals Matter. So just to take a little bit of time to talk about the industry we're in. The wearable device industry. The challenge with this industry is it is a super industry, very exciting, lots of technology development, suits us very nicely, except there isn't a viable subscription model. So what that means is you're only as good as your last sale. If there was a solid subscription model there, then we could build our revenues and manage our growth in a controlled way. The second thing is we have some very significant dominant players. You've got Apple, Garmin, and the list goes on. These companies are very well funded, have huge and sophisticated marketing machines. So although we do very well, and although we are innovative and creative, and typically ahead of these big players, it doesn't take long for them to catch up. And finally, the area that's of interest to us, the wellness solution for ordinary people. The problem with wearables is they provide contextual information, but they don't provide a full wellness solution. So unfortunately, it's a little incomplete. So our strategy then was to take a step back, as I mentioned, and seek out a more structured business opportunity where we could have customers who are used to paying $50, $100 a month for products or services, where we have competitors where we can distinguish ourselves by our creativity and innovative offerings, and also be able to rely on our patents so that we can protect our business and build a solid, sustainable, ever-growing business. So we have a video that I'd like to share with you now. And then at the end of the video, we revealed a product in Taiwan, and you can see the impact of how that went. So if we can roll the video, that would be great. Thank you.
Industry disruption doesn't happen often, but when it does, rapid and profound changes follow. Opportunities emerge. Think of the car replacing the horse and buggy, the computer replacing the typewriter, and the smartphone, well, that changed everything. We all know that big changes have a bigger impact when it's personal. And what could be more personal than having powerful tools and technology to support your wellness and help you live a better, more informed life? It is not easy taking care of your most important asset, your body, so that it can take care of you. No matter how hard we try, too often we're confused by conflicting information, overwhelmed by supplement choices, and underserved by one-size-fits-all solutions that don't solve much. It's time for change. Imagine a technology so powerful that it enables you to harness the capabilities and strengths of artificial intelligence for your personal benefit all day, every day. What if this technology listened to your body, identified your needs, and the very same day fulfilled those needs? What if this AI could tell you which choices and actions were best for you? What if it could select an optimized combination of supplements just for you based on your needs and deliver them to you instantly? What if you could measure, see, and feel the improvement in your body and well-being by taking your AI-informed personalized supplements and following its advice? What if this was all possible in the near future? What if we show you today what is going to be possible tomorrow? Nutramatic is a revolutionary in-home device that uses AI analysis of your biodata to prepare an optimized combination of supplements to meet your body's specific needs day after day. Using Nutralife AI and Nutramatic together can help to transform your wellness, helping you live better. Get started today.
So, as you can see, that was the event in Taiwan was incredibly exciting. You could feel and touch the intensity in the room, and people responded very positively. So, but what I'd like to do is just look at where we are today in the wearable device industry. From a wellness perspective, we're really at a wellness 1.0 solution. So what people do is they buy a wearable, they begin to count their steps, measure their sleep, check out their heart rate and heart rate variability, and then they get some feedback in terms of their lifestyle and wellness guidance. The problem with this is, fundamentally, it doesn't work so well because, and that's typified by how many people buy trackers and fitness devices and more expensive wearable devices just to use it for telling the time and perhaps sending an email. So we're happy to let all the big players play in that space. Whereas what we want to do is move to the Wellness 2.0 ecosystem. And what that means is we want to gather more data. Just having biometric data is not sufficient. What that does is it gives you contextual information about your activity, sleep, as I mentioned earlier on. But to provide a more interesting wellness feedback and guidance, it's the more data you have, the better. And this was the purpose of launching BioStrip. This strip can conveniently allow our wearers, our customers, and our users to measure a number of biomarkers. All of this data, so the biometric data and the biomarker data, goes into our Helo AI platform for analysis and recommendations. The recommendations are dynamic, so if your data changes, the recommendations change. It also allows an opportunity for precision nutrition, and that's where the Nutramatic fits in. There's no point going to all that trouble if at that stage you have to go to the store and define what you want and where, sometimes it's not available, all of these issues. So just to re-emphasize, Wellness 2.0 is about activity and all these attributes associated with that, and combining the benefit of nutrition as well. But this nutrition needs to be optimized nutrition based on your data, and then with a feedback loop so that is the nutrition you're taking actually working? Are you sleeping well? Is that the issue? Are you getting enough exercise? So it's not just about getting the right combination of supplements, it's a more holistic approach. So the question is, how big is the market? Well, it's substantial. Last year, it was 166 billion. But it's not just the size that counts. It's the fact that there hasn't been really that much innovation. There's pills, potions, all sorts of things that people take. Now, the question is, why do they take them? How do they know they work? These are the core questions that people should ask, and they should get an answer to. In addition, on the blue chart on the right, you can see 15 of the most popular supplements in the US. What's crazy is most people know those 15, but there's another 29,000 other supplements on the market that some people are aware of, some people are not. And that number increases by 1,000 new supplements every year. So how is an ordinary person supposed to figure this out? That's why you need AI. And that's why you also need a feedback loop to determine if what you're actually taking works for you. Because there's no point taking a generic supplement that might work for your friend who's advising you to take it, but your body composition might mean that it doesn't work for you. So then you're spending money, you've no feedback, and ultimately you've no benefit. So typically the questions that we ask are not, do you take supplements? Because more than 7 out of 10 Americans take supplements on a regular basis. This includes millennials. Of course, it includes, the greatest generation on earth, but every age group takes supplements. And the average spend is $97 per purchase. So it's a lot of money being spent. And the key question is, does it work for you? And that's the question that we answer. So it's all about the Helo AI feedback loop. We collect your biodata. The wearable device collects your biometrics. The BioStrip collects your biomarkers. All of this data is analyzed. And then the Nutramatic supplies you the optimized combination of supplements based on your data. But the key issue is the arrow on the side there, where it's about feedback. You take your supplements, but the AI engine is analyzing everything in the background to determine, did those optimized supplements work for you? Is there anything else in your life going on that might change that particular dynamic? So for example, maybe you went out on a Friday night, stayed up too late, didn't get a good night's sleep. So maybe you need a booster in the morning. Nutramatic knows this, prepares it for you, so that when you do rise in the morning, it's got taurine in there or whatever it is to make you enjoy that day a little bit better. But also, the system will call you back in the evening to say, you didn't sleep so well last night. Here's something to help you have a restful night. And then maybe the following day, after you have a restful night, you don't need the booster. You feel like going out, going for a walk, maybe going for a swim, whatever makes sense for you. But you can only do that because you've had a solid, restful night's sleep. And that's the big picture, and that's what Helo AI is offering. So it's feedback and continuous optimization. So what do we need to do to bring this forward? From a corporate perspective, we have a few items that we have to tick off. We need to complete our pending audits. We're considering uplisting to OTC QB, and we need to fund the development and launch of our Helo AI platform and new products. From an operational perspective, it's a lot more practical. The pre-launch of the Nutramatic concept is underway at the moment. Early in Q1 next year, we're going to continuously develop our AI platform. And in the second quarter, our plan is to start shipping Nutramatic worldwide. So thank you very much. If there's any questions, happy to go through those now.
Great job, Sean. Yes, we do have some questions for you. Talk a little bit about this Taiwan event. What was your uptake from that?
Well, first of all, it was a very enjoyable event. Lovely to meet customers. I say potential customers. If they were all customers, that would be fantastic. But I expect many of them will be. But they all grasped the concept. They understood it, and they began to say, yeah, I deserve better. I should get better. I should know if the supplements I'm spending money on actually work for me. Right. One of the things, we took a chance at the event, and we asked people to opt in to what we call our NAP, our Nutrilife AI program. And that is where they volunteer their data so that we can train our AI engine and knowledge domain. And on the day, we had over 300 people volunteering, which is fantastic. So for the next 24 weeks, they're going to be busy parting with their data so we can train our Helo AI.
Fascinating. I've been to a lot of the CESs in Vegas, but not that one in Taiwan. I bet everyone was very interested in this. I am interested in it. I'd be a great case study. I take so many supplements, and it's always that question, what is my body absorbing? What does it need? What does it not need? So explain a little bit more about the Helo AI platform. How are you using the AI to determine what our bodies need?
And Anna, that's the key issue here. As I say, more than 7 out of 10 Americans and similar numbers in Japan and many other countries take supplements. Mm-hmm. And the question, do they work? So what we do is we gather the data, analyze it, and present it back to the user so they can get feedback. And what all of this does is it provides engagement. We're also going to have ChatGPT to not just feedback the information, but personalize it so it's much more meaningful, much more engaging, much richer. The consequence of all of this is we're expecting that our population of customers will improve their wellness scores. So we want to be able to make some aggressive claims in 2024. And when, Anna, we ship you your Nutramatic, and when you begin to go through the process, you might be one of the advocates where you're looking at it saying, wow, this, not alone do I know it works for me, I can communicate how it works for me and what is the benefit. And it's not just about taking supplements, it's about the holistic approach.
And for people who don't want to wear any of these devices, how are you going to reach those types of people?
That's a good question.
It's a personal question.
Yeah. So let me just say, one of our devices is this. I don't know if you can see that, slim, very light device. And the feedback we're getting is that I don't like wearing watches or devices or whatever else, but I like wearing yours. And we're hearing that time and time again, which is unusual because it's very light and very comfortable. But to answer your question, we're going through some research and we're looking to bring out new products which are not wearable and non-invasive. BioStrip is one example of a non-invasive product, but we're looking at some others in the future. I can't get into that now, but maybe in the next meeting like this, we'll be able to share some news on that.
Absolutely. Well, talk a little bit about your rollout plan for Nutramatic.
Okay, so one of the challenges for us is we could have no orders for Nutramatic, or we could have 10,000, 50,000 customers demanding it. And the production lead time is a couple of months. So one of the challenges we had was, how do we manage this? The guy in the video, Alfonso Chofi, the guy in the nice, elegant jacket, his job is to manage the production process. And what he wants to know is, I can build it, and he can build it because he's been very successful pulling all the other devices together and launching on time. The challenge he asks is, how many do you want? And this is where our NAP comes in, our Nutralife AI program. So everybody who signs up for NAP 1 gets the first batch of Nutramatic. Everyone who, 24 weeks later, everybody who signs up for NAP 2 gets it 1 month after that. Everyone who signs up for NAP 3 gets it after that. So we expect to start shipping in May, and the NAP 1 users will get early previews and perhaps their Nutramatic earlier than that. So that's how we manage our costs, how we manage the inventory, and all of these things. So by May, we'll begin the process and we will know how many customers we have. If we get other customers, we'll just have to say, sorry, you need to wait in line. Next production run, you're in that.
Well, you have a customer through one of our viewers. We have Anthony Fitzgerald wants one, but he wants you to explain a little bit more. What is the retail price? And is it sold through distributors? How's it sold?
Okay, so we haven't revealed the retail price yet. We're still working on some of the metrics there. So you need to come back. Was it Anthony? Anthony? Yeah. You need to come back next year, or we will reach out to you when the time is right. And how is it sold? We have two choices. We can either go to a store and push it through stores, or we do it by, we're now in 2023, the world of influencers. So you need an invitation. So somebody will reach out to you and say, hey, Anthony, we think this works for you. If Anthony doesn't know somebody reaching out to him, he can reach out to us and we will find a way to get him an invitation code. But what we do is, rather than spending significant amounts of money on advertising and not reaching our target audience, we prefer to reward our influencers substantially through our VGen. One of our affiliates is VGen. They have a whole host of influencers worldwide, and we have a relationship with them. So the short answer is, you need an invitation code. If you have one, fantastic. If you don't have one, please reach out.
You hear that, Anthony? One more follow-up, and this is probably a good question for just a review again. When it comes to collecting and analyzing data, is there an opt-in for that? How is that done?
Yeah, I mean, it is crucial that we are compliant. Everything is opt-in. If you choose not to opt in, that's fine. You can also, there will be different levels. You can say, one of our other partners is a partner called In Persona. And what they do is allow you the opportunity to monetize their data. And our BioSense has an interesting capability, which is you can digitally sign your data. So we gather your data, we know it comes from you, from your device. So all of that data is collated, but you can say, I'm happy to monetize it, but don't say it's from me. Don't give you can give my zip code, but you cannot give my home address or anything like that. Or you can categorize all of these things. The nice thing is this data is going to be worth a lot of money. If you look at the big data players, the Facebooks and other people like that, a lot of their value comes from data. So the data play here is huge. But we must respect the regulatory authorities and compliance. So everything is on an opt-in basis. So
thank you for clarifying that. We have a question from Tom Loretta. He wants to know a little bit more about your patents. What exactly do they protect? Is it a tangible design, intangible technological process? And what is the value in your IP?
Yeah, that's a fantastic question. In terms of what it protects the design primarily. What we've managed to do is allow an IoT connected device deliver an optimized combination of supplements to the users. That's easy to say, very difficult to do. Clearly, there's a lot of moving parts. It's gravity fed, which it's providing a powder, an easy melt powder for the user. And what you need to do is there's blister packs, and these blister packs need to be open. The powder needs to fall out. Our customers will be very disappointed if they find that some of the powder is left in their blister packs in the waste. They won't be happy with that, understandably, and neither will we, because they're not getting the supplements they paid for. So Alfonso Cioffi and the design team and the engineering team have done a super job at building a device that works, and all of that is protected by the patent. In terms of value, we have been a little bit lax in terms of attributing value. So I hope in 2024 we're going to revisit that and apply a more appropriate value to that. But is it valuable? I should just say, is it valuable? Yes, it is, because we've heard from the industry on many occasions, people who have been employed in companies where they've said, I tried to do that 2 years ago in my company and we didn't succeed. And this was the power of the Taiwanese event, where people could come up, touch, feel, and sample the Nutrimatics supplements. So it exists, it's real, it's patented.
Carl Mathis has a follow-up. So when you're recommending the optimized amount of supplements, is there a revenue stream built into this? Do you buy them? Do you receive a commission or revenue share from the manufacturer of the supplements?
We buy the supplements and we put them into blister packs. These blister packs are put into cartridges and they are then provided to the user. We expect to charge a monthly fee for that. So depending on your usage, you might be a $99 user, or you might be a $149 family pack user. The whole thing about this is because it's an IoT connected device, it's a bit like your printer. When the supplements are running low, you will find that, you will be notified. a cartridge will turn up in your it will be delivered to you, and all you have to do is pop the cartridge in. You don't need to monitor, you don't need to think about it, you don't need to go to the store. All of this is taken care of. So not alone do they work, you're not going to run short. And in time, we expect that even the base formulations will change, so that if we find one supplier's supplement is better than another, we will substitute those out in the background. Or we find that maybe they work better for you, but they don't work better, as well for somebody else. You get one particular type and somebody else might get another. So we have a huge amount of flexibility there. And the key issue is we have feedback. So and we know what works for you. And we design the supplement delivery system accordingly.
Mind-blowing industry. I can't believe we are here, but we are here. Sean, we have so many more questions for you, but we are out of time. So we'll get these questions to you. You can answer on your own, and you got to come back in 2024 with some updates.
Look forward to it. And thank you very much for having me, and happy to answer all the questions. Thanks
okay,
again.
Wonderful. Thank you for your time. Great presentation. All right. Thanks, Sean.
Thank you. Bye-bye.
Everyone stay with us. We'll be right back.